Hello, good morning. I'm thrilled and delighted to be here and to talk with all of you. I'm especially delighted that there's so many students in the room because actually you probably know and understand more than anyone about what I'm going to talk about today, and I'm really interested in your views and thoughts and responses. I'm really thrilled because this is the first time we've been able to present anything about the new draft education standards for midwives, which, as Sue has just said, I'm leading on behalf of the Nursing and Midwifery Council. You'll find there are some NMC colleagues in the room. We have Josh, Verena and Jackie, and they'll be downstairs. They're waving at the back. They'll be downstairs at the stand to talk to anybody if anybody wants any more details, because as Sue's just said, the sessions today are quite short, and so what I'll be doing is a lightning tour through where we are with these draft standards and how you can all individually and collectively contribute to them, because the formal consultation is happening and opening next week. So in a sense, you're getting a privileged look at this, you're getting a first shot, and I think this is a bit of a soft launch of the consultation, so we can have your responses sort of immediately, if you like. So here you are, getting a bit of a privileged view, and quite right too. Just a bit of logistics, any tweeters in the room, any Facebook users, anybody who wants to get on the website and have a look, here's your information. But don't panic if you decide later that you want it and you didn't write it down, because all of this information is at the stand. So please do go and get it and join in the conversation that we need to have. So what is this whole project? The Future Midwife project has been running for about 2 years. It's to revise the education standards for all students in the country. It's setting the bar for entry onto the register to become a midwife. Arguably, there isn't anything more important for the profession, because if that's what students have to know and be skilled at the point of registration, you know, that, if you like, is the foundation stone of midwifery. It's fantastically important, and that's why we really, really want your views. So any students in the room, all the standards that you currently have to meet, they were set in 2009, they're being revised, they'll come out, and we're seeing that they'll last possibly through to maybe 2030. So really important as a foundation stone for the profession. The future path for midwifery is being set as this is happening. So we're really excited. Oh, you can tell. We are really excited and pleased and delighted about this. This is the challenge that we've been set with. How does the regulator, the Nursing and Midwifery Council, set standards that make sure newly qualified midwives at the point of registration are able to meet the needs, wishes and views and preferences of women, newborn infants and families, that they are safe, that they are effective, that they are respectful, and that they are compassionate. So that's what we're about, and we're trying to write all that down. It's funny because a lot of people know very clearly what a midwife is and needs to be able to do. Writing it down is another matter, and trying to capture that and capture it right so it's not confusing, it's not ambiguous, and it actually gets to the heart of what really good midwifery is. We're working in this context. You will know this context. I don't have to stop and explain this slide to you. There's lots going on in midwifery, whether that's globally with the Sustainable Development Goals, whether that's nationally with a background where we have growing inequalities and growing poverty, as a context in which everybody's working, where we've got new maternity policy across all the 4 countries of the UK, where we have new evidence that we have to respond to, where we've had inquiries into really, really important failings in midwifery care that we have lessons to learn from, and so on and so forth. You know this. I'm not going to pause and explain it, but that has been the context of our work, and thinking forward, the context into which new midwives will be practicing, growing and developing their careers. So the Future Midwife project has been informed by evidence, existing and new. We have updated the evidence base to really tell us what it is that women and babies and families need, and therefore what midwives need to be able to provide. We are in a context, and we've taken into account the changing demographics and population health profiles. Women are having babies at an older age. Do you know, when I qualified as a midwife, the average age to have your first baby was 22. Yeah? It's now nearer 30. So, okay, I've been qualified a long time, but actually, as a transitional demographic change, that's incredibly fast. And we're dealing with that, and all of the lifestyle changes, population health changes, increasing diabetes, increasing obesity. You know all that, I don't have to tell you that, but we've had to take all that into account. We've learned the lessons from the key reports that have come out into the failings, I've mentioned that already, and national policy in the 4 countries. We've also folded in the thinking from the Lancet series on midwifery. And if you've read it, I hope you'll recognise this framework where we've tried to capture the elements of quality care that women, babies and families need. We've evidenced that with hundreds and hundreds of different studies. If you haven't read it, please go and read it, because this is really at the heart of the standards and saying it's not just what you do, the practice categories, if you like, on the top row here. I don't know if you can read it, but go away and have a look if you like. But it's how the care is delivered as well. It's the organisation of care. It's the values that, if you like, the organisation and the individual holds. Respectful care, communication and tailoring care to women's needs. And then the philosophy of optimising normal processes and strengthening women's own capabilities, not doing to, but working with. And then care providers who work in a context where you work in interdisciplinary ways. You know, you don't work alone, you work with others, you work with other midwives, you work with other interdisciplinary colleagues right across health and social care. It's astonishingly complex, midwifery. And one of the really interesting things about writing this down in the draft standards has been colleagues from other disciplines saying, I had no idea that this was what midwives had to do. And I think, you know, if we achieve nothing else in a funny sort of way, achieving a better, improved understanding across the disciplines and with the public about what it is that midwives do will be incredibly important. So all of that, we've also done a whole lot of external engagement. We've had a fantastic thought leadership group. There's people in the room. Laura's right here. There's a number of people who have met with us pretty well every month across that period of time to really challenge us and have very intense debates about the knowledge and skills that midwives need to have. They've been a fantastic cross-sectoral group, midwives, educators, people from other disciplines, people from advocacy and other stakeholder groups and so on, all meeting together. We've had loads of engagement. Has anybody in the room come to any of the events that we've run right across the country? Can I see any of you? There's a handful of you. Thank you very much. We've had events right across the country. There will be more coming in the consultation. But we've had all these people attending those groups, but we've also gone out seeking specific meetings with stakeholder groups of all sorts, and we've gone out and really challenged ourselves to reach as many people as we can, as many different perspectives as we possibly can. So over 600 people have directly had a voice so far in the shaping of this draft. The input has been phenomenally generous and really, really positive and really, really good. And that consultation and engagement will continue on over the next 3 months. I'll come back to that. Internally in the NMC, we've had all sorts of reviews. We've had a regulatory review. Is everything consistent with other relevant regulations in the 4 countries? Because, of course, there's different things happening in the different 4 countries. There's been a legal review. Is everything consistent with current legislation in the 4 countries? And is it consistent with EU legislation and the current and the possible changes? I hope there's a wave of sympathy coming from you here to anyone in the NMC who's currently in that role, because keeping a close eye on that is incredibly important. There's been a policy review. Is everything consistent with policy? Do we need new policy development? Are these standards challenging what we're currently doing? Because I have to say, we've been setting the standards according to the evidence and the engagement, not according to expediency. We've been genuinely asking the question, what do women and newborns need? So if out of those standards we have to make other changes, those need to be discussed. So that will be under discussion. We've had stakeholder review and challenge from all sorts of people. Women's Own Voices, senior midwives, academics, educators, the college, the Council of Deans, and so on, which has been really helpful. And ongoing review and challenge through that time by the Thought Leadership Group, by the Midwifery Panel in the NMC, and by Council, NMC Council. So we're trying to be transparent, we're trying to be accountable, if you like, but to bring in all of those voices and make sure what we do is right. And what we've ended up with is a draft, so far a draft of the new standards that is coming out for public consultation and will be out there for 3 months, launching next week, and will be out there for 3 months, because we want the new standards to be as good as they ever possibly can be. So there is a hugely genuine open door, and everybody is listening to try to make these draft standards that we have written even better. Okay? So far, these draft standards have been recognised as creating transformative change, and they're very, very well supported so far, internally and externally in the NMC. And we need transformative change. We need the right path forward for midwifery and for midwives to genuinely, truly meet the needs of women and babies, and genuinely and truly to implement evidence-informed care, which is what I'm sure everybody wants. So, what do they look like? So first of all, I'm going to take you through the key attributes that we have embedded into the standards. Now, there's going to be, I think, 4 slides with these key attributes, so please just kind of focus with me. I don't have ages to talk you through all of them. If we dig down into each of them, there's loads of information. But just as headlines, first of all, midwives need to be autonomous and accountable. And inside that, you'll see there's little bullet points under each of these headlines. I'm not going to pause on each of them, but they all matter. They need, right from the start, to be focused on equity and human rights. Every woman, every baby, every partner and family matters, leaving no one behind, making sure that their needs are met. That brings in a whole raft of stuff around cultural competence, around understanding differences and respecting those, and around inequality. They need to be evidence-informed with knowledge and understanding and skills. Now, we've had lots of debate about what to do with detailed skills as well as knowledge, and at the moment we have integrated those throughout the document. Be interesting to see what you think when you read them, but at the moment we haven't separated them out. We've kept them very closely, proficiency and skills together. That's been really an important part of our discussions. Absolutely at the start, and right through everything, focused on the needs of women, newborn infants, partners and families, working in partnership, building relationships, advocating. Advocacy's been a huge word all the way through, embedded all the way through. Providing continuity of care and carer. The evidence has been telling us for how long? 20 years? The policy documents are now coming through with that message very clearly. We have together to problem solve how this works and how it happens. But the evidence is clear, the outcomes are better for women and babies if they get this. And embedded in there is not just continuity of midwifery, but it's very much multidisciplinary and multi-agency working. Confident and safe and responsive. That's very much what we're aiming for. understanding normal processes and recognising deviations. It is about normality. It isn't just about normality. It's about whatever women and babies need. And so that is whatever happens to them, the midwife is there and responsive. Public health, health promotion, clinical and social care perspectives, all of those matter, and you know that very well. Women have social challenges as well as health challenges through their childbearing journey, and the midwife is the linchpin holding all of that together for the woman, with the woman. Future focused with skills to keep informed and updated. We don't know what's going to happen next year, do we? You know, when you think about health challenges coming down the line, when I became a midwife in late 70s in Scotland, nobody had ever heard of HIV. You know, 7 or 8 years later, it was huge. We don't know what's coming. So students have to be prepared, able, responsive to learn to deal with new things. And to be a leader and a scholar, hugely important, being able to learn and continue to learn and to lead, and to work within an organisation and to work with multidisciplinary colleagues in safe and confident ways, knowing what they do as well as knowing what the midwife does. So those are the key attributes that are woven through. There are 5 domains. Now again, I'm going to go quickly, please kind of try and stay with me because, you know, there's quite a lot of information here. There are 5 key domains. So the first 3 are on this slide. And these domains are evolved out of the Lancet series and midwifery framework. The first one, absolutely essential, I'm sure you'll all agree, is being an accountable and autonomous professional. And so embedded in there, there's a lot about professional working. Second domain is the midwife's ability to provide and promote continuity of care and carer. We recognise this as fundamentally a platform from which midwives work, from which women receive their care. So it's right up there. The third domain, and I'm going to come back to why it matters in a minute, is universal care for all women, newborn infants and families. And in there are 3 sub-domains. One is the midwife's role in public health and health promotion. One is the midwife's role in assessment, screening and care planning. And one is the midwife's role in optimising physiological processes. All 3 of those really important. Moving on to domain 4, it's additional care for women, infants and families with complications and further care needs. And the first subdomain there is first line assessment and management of complications. And the second is the midwife's role in caring for and supporting women, infants and families requiring multidisciplinary care. And then the 5th and final domain is promoting safe and effective care, the midwife as colleague, scholar and leader. And that's about the midwife working with others to promote safe and effective care in an organisation with other disciplines, and also through developing their own knowledge, positive role modelling and leadership. So that's the 5 domains. In at the heart of this is a kind of radical rethink about midwifery. You will not find a split between low risk and high risk. What you will find is something that's about universal care for all, and that means all. That doesn't just mean low risk, that means all. And then additional care as well for people with complications and further care needs. That means they carry on getting the just as good midwifery care even though they have additional needs. You don't get less midwifery care when you get complicated, you get that, which is a bit different from a high risk, low risk split. Continuity of care and care, I've already said, is embedded in there. The working with others and the being colleague, scholar and leader is all new. I can tell you lots of other new things. There's public health, for example. There's mental health, for example. These are the key themes across the domains. I'm only asking you to scan them or take a photo and take them away and look at them, but these key themes are woven right through the document, whether it's about safety or advocacy or public health or human rights or multidisciplinary working or continuity or whatever. They are all embedded throughout. So although we've got domains that go a bit separate, these themes try and hold everything together. I've got very little time left. I'm going to give you one example of how we moved from evidence to standard, okay? Because it's really important, I think, that we demonstrate that what we've done is what we said we would do, which is start with evidence, take the engagement, and end up with the standard, yeah? So here's an example, one example only, of a standard. Demonstrate the ability to provide continuity of midwifery care across the whole continuum for women and newborn infants, with and without complications and additional care needs. There's quite a lot in there, isn't there, in one proficiency. What did we do? We looked at the evidence and the reports of the evidence of why that mattered and what it would do. We then listened to all the engagement and read all the policy that was relevant. And we put all that together. We had core design principles and the Lancet framework guiding us through all of this, and those principles coming together with all of that meant that we ended up writing this standard that you have just seen. Each of those phrases evidenced and coming out of the engagement. I could have shown you this one, which is about optimizing normal processes, but I'm not going to, because you can go and read it for yourselves. But I can promise you that it does that pattern all the way through. Every single proficiency does that. What next? The public consultation opens next week on the 12th of February, but you, as I say, you're getting the first view at this. There's an online survey open to everybody, 4 versions for midwives, lay-in service users, other professionals, and an easy read version. Closes on the 9th of May. There are events already organised across the 4 countries for face-to-face input and discussion. There'll be Twitter chats and webinars open to all. So please, 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 we're asking these big questions. We're asking more detailed questions as well, but these are our core fundamental questions. Do they meet and reflect the key attributes of the future midwife at the point of registration? Are they realistic and achievable? Is anything missing? Is there anything that should be removed? Lots of other questions. Please tell us what you think, because these standards will only be as good as the input that we have from all of you, all of your colleagues, and from any parents or other stakeholders that want to do that. There's all the information about how to do it, and although I'm going to say thank you, I'll leave that slide up just for a sec in case you want to take down the details. Thank you very much indeed.